My name is Tosin Omolaja, and you're welcome to NAFDAC and Your Else, where we bring you all the important information you need to know about NAFDAC, the agency saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. Several issues pose as threats to our health. One of such is what we consume. Consumption of unhygienic made food have created different health issues to the public. NAFDAC, as a regulatory agency, carries out several inspection activities to ensure adequate compliance of good manufacturing practice standards by food manufacturers. On today's episode, we examine NAFDAC's activities on food production in the nation.
We have to be sensitive to what we put in our body. We have to become more acculturated to reading labels. And also to test what may be good, may be bad. If all of a sudden you start feeling nausea, you better find out what type of food. It's not somebody that is trying to kill you. It's very likely what is in the food. We have to be sensitive to what we put in our body so that we use less drugs.
The Food Safety and Applied Nutrition Directorate, FSAN, is the unit under NAFDAC, saddled with the responsibility of ensuring food safety in the country.
We all know that the consequences of unsafe food can be serious, really grave when they happen. So it is in everyone's best interest, it's in all our best interest to ensure that we take actions to ensure that food produced is safe at all times. So all food producers have the ultimate responsibility to manage the safety of the foods that they produce and also to build quality into their production processes to ensure that at each time, every time, food that comes out of their production processes are safe, are wholesome, and of good quality. And so this way they contribute to a food system that ensures that only safe food is produced, that keys into healthy diets and good nutrition. And you know that we all need good nutrition to thrive. And so this underscores the importance of the work that we do here in the Food Safety and Applied Nutrition Directorate. Essentially what we do is to guide food manufacturers. Watch, the key word here is guide. Guiding them to compliance with good manufacturing practice standards and also monitoring and enforcing compliance to those standards. And also the requirements of food safety management systems that help them to identify and control food safety hazards so that the foods that they produce, each time they produce, are safe and of good quality. We all know that safety is critical because you don't want people to consume food and then it's injurious to their health. So essentially what we do here is putting in place the necessary regulatory measures to guide to compliance, to monitor and to ensure compliance to good manufacturing practice standards and the food safety management systems. Requirements of those food safety management systems are met at all times. However, we know that there are plenty of unsafe and unscrupulous practices that are going on with food. I would like to use this medium, in addition to all our other sensitization activities, to reach out to our consuming public so that they are warned on the dangers posed to health by these practices. I'll just mention a few of them. We know that potassium bromate has been banned for use in Nigeria since 1993. Unfortunately, we still get use of potassium bromate as dough enhancer in flour, which is used in bread, other baked goods, baked products. And this potassium bromate, it decomposes important vitamins like vitamin A, B1, B2, and E in flour. And these are vitamins that the country has decided through its mandatory fortification program to use in fortifying flour products. So use of potassium bromate is really harmful. It's a harmful practice because it also causes cancer, kidney failure, and hearing loss. So this is something that we all need to guard against, and the agency is indeed doing her utmost to ensure that these are bad practices that we look out for when we go into bakeries. So that's one example. Another example is the wrong application of agrochemicals in storage of grains. So for example, the sniper. We all know about the use of sniper for storage and preservation of agricultural commodities. So that's another harmful practice, and that's also an area that the agency has put measures in place to guard against. There's also the practice where there's the aggregation of expired, adulterated, contaminated and infested packs of ready-to-eat oats and cereals. You know, where these are just aggregated into jumbo sacks and they're sold in measures in the open markets. And there's also, the agency has a grip on that as well. Another example I would like to cite here is the use of dyes, azo dyes in palm oil. These are banned colorants like the Sudan dye, Sudan 1, Sudan 4, and these are used as, I'd actually say this is a food fraud, because this is putting in color into the palm oil that the palm oil does not possess to make it look more than what it is to the unsuspecting consumer. So there's also using of expired raw materials. Unfortunately, expired raw materials in the production of food. You know that is what goes in that comes out. If you use poor, low-grade, expired raw materials, you can imagine that the end product is not going to be that safe food of good quality that we're looking for. When you go into a processing, food processing establishment, usually you will have your raw materials. They need to carry best before, they carry expiration dates, right? Because you need to know when not to use that material, when it is no longer good to use as a raw material for production. So you take that out of your system, out of your inventory. So that's why we have what we call it a FIFO, first expired, first out. There's also the FIFO, first in, first out, and that's good storage practice, inventory management. So the onus is on the food manufacturer to ensure that what their inputs, ingoing materials, are still good for use, because there is no way you're going to make a safe product, produce a safe product, if your ingoing materials are expired.
NAFDAC and your rails will be right back. Please stay tuned. Welcome back. If you are just joining in, you're watching NAFDAC and your rails. An important aspect of healthy living is maintaining good hygiene practices. As a manufacturer of bread or other consumables, the practices of good hygiene are not limited to only the environment. It also involves personnel, equipment, and other necessities needed to manufacture a product. NAFDAC, in safeguarding the health of the nation, ensures manufacturers uphold good hygiene practices.
Hygiene basically has to do with cleanliness and tidiness, and they go together. If cleanliness cannot be sustained without tidiness. Tidiness has to do with proper arrangement, proper segregation. Now, good hygiene practice is like a culture of maintaining cleanliness and tidiness in a facility. So when it comes to a production facility, a lot of things are considered, starting with the personnel. Personnel are expected to have personal hygiene, and before they are allowed to enter the facility, they are supposed to wash their hands with soap and water in what we call hygiene stations. All facilities are supposed to have hygiene station at the entrance for the personnel to wash their hands. It is also expected that the medical condition of the production staff or the food handlers should be assessed, because we don't want anybody that has disease conditions that can be transmitted through food to work in a food facility. That is very important. Now, the next thing is about material management. All the ingredients or the raw material for production are supposed to be certified okay. Their condition, whether they are damaged, whether they have expired, supposed to have been examined before they are used. And banned items are not allowed. The whole essence of GHP, good hygiene practice, is to prevent contamination. We know if you allow pest infestation in a facility, we are encouraging the contamination of the materials and the food. So we need to use all means to prevent infestation of pests. In bakeries, the common pests are the rats. So we encourage bakeries to ensure that they block all holes through which rats can enter their facilities, and to ensure that they do regular fumigation. Now, equipment is very important to sanitize the equipment because most of these equipment are in contact with the bread, especially those that produce the sliced bread. The blade for cutting the bread, that is one of the the critical control points, because if that blade is contaminated, it's going to contaminate the already produced bread, and it's going to be packaged like that. That is very dangerous. We expect that equipment should be sanitized, clean and sanitized regularly. And in fact, food contact surfaces also, where this the dough, the kneading tables, and anywhere that's that is in contact with the food in the course of production, we expect such surfaces to be sanitized. When you talk about the exterior, you are looking at the drainage system. It's very important, because if the drainage system is not well cleaned, it's going to impact on the product, because pollution will set in. So it's a source of contamination. We ensure that all the gutters are well drained and cleaned from time to time.
Sales of unprocessed packaged water has been a great problem to the health of the citizens in the country. NAFDAC, as a regulatory agency with the mandate of safeguarding the health of the nation, ensures packaged water manufacturers undergo a strict registration process before approval, and also carries out constant routine checks to ensure compliance to good manufacturing practices.
Ideally, water is a high-risk product. Many Nigerians see water as a small-scale industry, particularly when you talk about sachet water. And they feel there should be less regulations and allow them to distribute the water and sell, more of profit-making venture. But one thing they need to understand is the fact that only a mistake or a contaminant in water alone can kill a local community. So we're not taking it lightly. Most often we'll go for routine inspections. It's not just registering the water. We monitor seriously what is going on. And ironically, the mentality of our people is shocking. The moment they come for production, they meet the documentations are okay, the factories are intact, they meet NAFDAC regulations, and they get their numbers. And immediately they have the numbers, they go to sleep. You enter a cloakroom, for example, where ideally that should be the first place you remove your clothes, wear the one for the factory, change the shoes, which meet the standards when you got your number. Then you find a bed, you see somebody sleeping, you see machines, you see gallons of oil, things that can actually contaminate the end product. They don't renew their documents. They wait until when NAFDAC will come to disturb them. They do not in any way have treatment plans. Some of them, they have the modules, which is okay from the beginning, but they found out that they don't even bother to reload these treatment modules. They keep on using and using and using and using 1 year, 2 years. And there's one unique thing about treatment modules. Without changing them, there's no treatment. You must have an in-house check. For example, pH meter. The table water of any location is different. They can never be the same. The geological survey, the one you have in Lekki cannot be the same in Ikorodu. The one you have in Isolo cannot be the same in Aja. So certainly when you have rain, for example, when you have rainwater going in, the level changes. the treatment certainly is going to be different, because over time, when you use these treatment modules, they get worn off. So certainly, if it's 6 months it takes for somebody that has one machine, it cannot be for you to upload your treatment modules. It cannot be the same for somebody that has 20, because your production is much compared to somebody that has one. So those kind of mentalities, we try to train our people. That is not the same thing. So if you are looking at 6 months before you upload your modules for treatment, change the selection modules for your sand levels, your activated carbons, before you now change your microfilters, you can't compare both. It's totally different. You find out that most of them, again, they have the infrared. After going through the treatment modules, we have the UV water sterilizer. It's expected that the UV should be working, most especially for microbial disinfections, but they don't even bother. It's like, what do you call it now? A furniture to most of them. After all, is what NAFDAC wants them to put in place. But again, do you monitor it? Does it actually do the work it's supposed to do? But they don't. You know, so in most of our routine inspections, those are part of the things we see, and we try to lecture them. We do a lot of trainings, stakeholders meetings, to actually sensitize them about this. But yet, some of them, they still don't do it. And again, when we talk about expired license and you need to come forward, one challenge we have is for them coming forward to renew their licenses. They keep complaining they should be in the micro sector, they are micro people. Water is not micro. Water is so significant that no matter how you try to cover it, it's not about the profit. It's about the people that are taking this water. It's about the people that need this water. The areas, for example, in Lekki, let's take that as a case study. Most of the boreholes they have there, you know, is salty water. And it takes a lot of treatments and a lot of money to actually do a lot of treatment plants in that axis. So you find out that the water factories in that area are booming in business because people rely so much on this sachet water and bottled water to be able to use in that axis. So if you do not monitor them, they don't do the right thing. It's more going to be like business, cabbage in, cabbage out, cabbage in, cabbage out. So it takes a lot of effort, and it takes a lot from the people to the consumers. They should reach out to NAFDAC. We have a consumer template in which we have desk officers in all stations of NAFDAC nationwide that you can reach out to. We want Nigerians to be our partners in these regards. There are so many places we cannot reach out to. You have issues. You see where they have complaints. We've had instances, for example, most especially in Yanokwaja area, Limosho areas, for example, that people have come forward and they've given us lowdown, whereby you have factories in the market, no treatment plant. We've seen instances whereby they report to us. People are taking water from wells. Some people will just pour the calcium, the chlorine inside the well. They feel that is the only form of treatment, that the water is treated. But hello, that is very, very wrong. So we've seen people that will come forward to tell us what is actually happening. And due to ignorance, a lot of people just go into the business because my neighbor is doing it. So that is how it is done. And NAFDAC gave the number. But the number given to that neighbor is because of the peculiarity of the treatment and the area. So it cannot pertain to you. Certainly, we lock up the facility immediately if it has to do with food safety, because you cannot continue producing, making money, and killing the people. It can't work. So we seal up the facility immediately. We have administrative penalties so that by the time you go through such administrative penalties, people that see what we are doing will understand that it's not a matter of garbage in and garbage out. Then after that, you come again to learn how to put your facility in order. we call it GMP reassessment. We have what we call the root cause analysis for all these things. You have to do the root cause analysis and you have to give a CAPA for that. That is corrective action and preventive action. So that in future, such will not reoccur. Then for us to open up the facility, these two documents must be submitted. Then when we open it up, you have to do the GMP, put it in order to meet specification. And after that, you must obey and we'll come back to come and ascertain that the place is in order. Then you can start your business. Then we can come unannounced to come and cross-check again if what we agreed should be the real thing is actually done. When it comes to water, fine, it looks small, but it's high risk. So in the classification of NAFDAC products, water is not classified under small scale or micro because it's a high risk product. Because of the rate of contamination is very high.
NAFDAC as the regulatory agency, there's only so much that we can see because we cannot be everywhere at every time. So we do urge the consuming public that if you see a practice that you know to be unsafe, a practice that you know to be an unscrupulous practice, a practice that you know will not result in the kind of food that you want to consume, then please make a report to NAFDAC. And we are always ready. We are alive to our responsibilities in the mandate that we have been given, and which we sum up as saying safeguarding the health of the public.
That's our package for today. Please join us, same time, same station, next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. Taking the NAFDAC-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the MedSafety app from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.